So for this quick workout, it's a follow along with me workout. So feel free to grab your chair, sit down with me. I'm going to go through all the repetitions with you with this workout. We're first going to start out with just some really easy exercises. We're just going to do heel raises. So you're going to lift up your heels and then we're going to lift up your toes. So up and down, heels up and then toes up. If you can't get those toes up, scoot your feet a little bit forward and then do the exact same thing. Heels up and toes up. You might notice your toes come up a little bit further if you extend your legs out just a little bit more. Just has to do with the angle of the ankle, makes it more doable. So just nice and slow and controlled with the ankle pumps. I'm sure you've done this exercise before. This is a popular one, but just kind of starting out slow, just getting warmed up. And we'll do each exercise here for about 1 minute each, just to, again, get the blood flowing. Sometimes getting that blood flowing is really all you need to do to get rid of that stiffness for the short term. Okay, our next one, we're just going to do some marches. So again, slow and controlled. With marches, I like to have everybody sit nice and upright. So if you're leaning back, I mean, you can lean back if you want to, but if you want to get some core contraction, sit nice and upright in your chair and don't lean back. That makes it a little bit too easy. But I understand everybody's at a different starting point here, so you might need to lean back if you need to. That is okay with me. So all of these exercises, again, are great for increasing blood flow. We're just kind of trying to get the joints moving. Joints are designed to move. Joints do not like to stay stiff and in the same position for long periods of time. That's probably why you experience stiffness when you sit for a long period of time, but especially after a knee replacement, after a big surgery, all that swelling that's in the knee is definitely going to be causing some of your stiffness. So if we can get the body moving, it'll actually remove some of that swelling out of there and get you some relief with that stiffness. Okay, our next one here, feel free to do both legs. Let's start with your non-surgical leg first. Unless you've had a bilateral knee replacement, you'll want to do both. But we're just going to kick that leg out in front of you. So just a sitting kick and then switch to the other leg. If you cannot do a kick on that surgical leg, just tap that foot forward and bring it back. Kick out with that non-surgical side, tap forward, tap back. So just do what you can here. If you are more advanced, you can kick that leg out in front of you. And again, this is just a mobility type of workout. It's not necessarily a big strengthening workout. If you are looking for strengthening, which is your long-term relief to stiffness, because stiffness is going to linger for several months, 6 months, even up to 12 months post-surgery. If you're looking for long-term relief, you need to be doing an exercise program. If you don't know what to do, I do have an exercise class on my website, succeedcourses.com. It's my most popular class on my website. It's called the 4-week strength class. Just go to my website. You'll see it right there on the front. It says 4-week strength, balance, and stretching class, because we do a little bit of balance. We do some stretching. It's a great class. We have really great results. Just read the reviews and you will see for yourself. Okay, our next one here. With the opposite arm and the opposite leg, I'm going to have you tap your toe and go back. So just extend that leg out, tap the toe and go back. So you're kind of reaching forward. An opposite arm, opposite leg. Tap the toe and go back. If you can't reach to the toe, that's okay. We're just, get towards that area and kind of reach towards your toe and switch. And let's pick up the speed just a little bit with this one to really get the blood flowing. Getting the arms involved. We're also getting a good hamstring stretch. I call these the hamstring taps. We're stretching the hamstring and we're tapping the toe. I call it hamstring taps. I don't know. I just make up different words to these exercises so I don't forget them. That's half the battle. All right, try to keep up with my pace here. Just tapping those toes. You might start feeling it in those hip flexors. Hopefully you are sitting nice and upright too, not leaning back to get a little bit of that core working. All right, great job. Next, same thing. We're going to do opposite arm, opposite leg. So we're going to let's do the non-surgical leg first. We're going to tap We're going to rotate in and tap, come back down. So you're coming into a figure 4 position. So the foot is coming in towards the other knee. Tap, go back down. Tap and down. So your hands are kind of hovering up here. We're just trying to get that leg or that foot to come up to your hand. So, and again, if you don't have this much range of motion, that's okay. You know, maybe you put your hand down here and we try to tap. We try to tap, something like that. We're just trying to get the body moving, trying to get, this is a hip joint exercise, trying to get that hip moving back and forth. And my legs are a little bit opened here, so I have room to kind of rotate that leg inwards here. So we're almost done here. Hopefully you're feeling a little bit looser already, and feel free to do this workout 2 times if you feel like, man, this is really helping, but I wish it was a little bit longer. You can always replay this video. Do it as many times as you want. That's a good thing about YouTube. All right, doing good. Okay, next one here. We're gonna do out with the arms and out with the legs. Come right back in. So straight arms, straight legs. These are called star taps. You look like a star. So we're sitting at the edge of the chair. Don't fall off the chair, please. And we're coming back in. So the faster you go, the more, you know, your heart rate's going to increase, get that blood flowing. We're also moving those joints. We're moving those knee joints. That's what we need to get the stiffness out of the knee. Again, this is just a mobility workout. If you want that long-term relief, you got to join the exercise class. You have to be doing a progressive exercise program. If you're doing the same exercises over and over and over again, you will not get stronger and that stiffness will linger way too long. So make sure you're doing a progressive exercise program. That's exactly what I can help you with. I only work with patients with knee replacements. This is my specialty. So if you want an expert, that's me. So join my class. I would love to have you in my class. And I love to connect with everybody. On Fridays, we do our live Q&A and everybody logs in live, asks me questions. It's a lot of fun. All right, very good. Next, move back in your chair just a little bit. We're just going to do a big open and a big close. This one's best if you sit nice and upright. Big open, big close. Make sure your knees are following the feet. A lot of times people compensate like this. The feet will go out, but the knees will stay in. So this is not what I want. We want open and close. Let's pick up the speed here. Doing great. Almost done. We have 2 more, and they're kind of stretches at the very end. So you're kind of done with those exercise, mobility type of exercises. Then we'll move into some stretches. We've got about 20 more seconds with this one. We're doing all the exercises for about a minute. Sometimes I talk too long and I lose track. Almost done. All right, very good. So next, what we're going to do with your surgical leg, I'm going to pretend this is my surgical leg. Put that foot right out in front of you. So my heel is facing downwards or is on the ground. My heel is down on the ground. My knee is super straight. My other leg is just here for balance. So just kind of put it out in front of you. All we're going to do is just lean forward. You should feel a stretch behind the leg, behind the knee, behind the calf. If your knee isn't completely straight yet, this is a great exercise for that. We're going to hold this here 30 seconds. Keep holding 10 more seconds. And I want you to lean forward at the chest. If you're rounding your chest, I want you to straighten your posture and lean forward with the chest leaning or leading forward. That's going to make a difference. All right, take a break. Kind of shake out those legs. Let's do that one more time. So foot forward and just lean into that stretch. Again, I like to hold stretches about 30 seconds. If you're doing stretching shorter than 30 seconds, it's not making a huge difference. But I like to make a disclaimer. If you're early on in your recovery, sometimes stretching more than 30 seconds is not doable. So of course, listen to your physical therapist. In my exercise or in my educational courses, especially my post-surgery course, we start out with stretching for just, maybe 10 seconds. So again, I have all of my information on my website if you're interested in any of my courses to kind of get on track with your rehab. My post-surgery course is one of my most popular to get you through day 0 to day 365. I have everything in that course. It took me a long time to write that course. Okay, our next one. Let's take your surgical leg. You're going to bring it up towards your chest. Interlace your fingers behind your thigh. We're just holding here, and I want you to let gravity pull that knee down so best you can. So the arms are kind of doing all the work. Lean back in the chair as well. Holding here. Let's do about 30 seconds. And just kind of relaxing in this position. Really let gravity pull that knee down so you feel a good stretch in the front of the knee. That's that quad muscle in the front of the knee. Another course I have is a knee bending course. That's my new one. If you're struggling with knee bending, I have a course specifically designed for knee bending after a knee replacement. Let's rest. Have awesome results with that course. People who have been stuck, they do the course and they have full range of motion. Pretty amazing reviews. Again, everything's on my website, succeedcourses.com. So make sure and check it out. All right, we're almost done here. We'll do about 20 more seconds with this stretch. Doing great. Hopefully you're feeling loosened up. If not, start this video over, play it again so you can get loosened up, get rid of that stiffness in your knee. All right, we are done. Great job. Thanks for joining me. If you have any questions at all, please go to my website, succeedcourses.com. I have a contact page there too. I do phone consultations, a little bit of everything. I'm here to help you. So please use me as a resource if you're struggling with your knee replacement. Thanks for joining me.